Good morning, everybody, and thank you for the kind introduction. First of all, I want to thank the organizers for giving me the opportunity to present the fragment screening and biophysical characterization capabilities of WuXi AppTec's HitS platform. Today, I want to first give you a general introduction to the newly formed HitS platform. Then there will be some general consideration about fragment-based drug discovery, and then in the main part of my talk, I will walk you through our HitS service portfolio, ranging from protein engineering and production to biophysical screening and further to hit validation and structural biology. There will also be some additional information about follow-up services that we can offer to progress your drug discovery projects. WuXi AppTec's HitS platform is a newly built business unit, which is a part of WuXi AppTec's Research Services division. At the beginning of this year, the WuXi Dell screening unit joined forces with Germany-based Frelux, a 100% subsidiary of WuXi AppTec. We offer services at the early stages of drug discovery projects and support our clients, especially at the target and hit finding stage. Our key expertise lies in customized protein production, screening, especially DNA-encoded library screening and fragment screening. Furthermore, hit validation as well as structural biology by X-ray crystallography is a key expertise in our company. On top of that, we also already conducted first successful cryo-EM projects. As you can see, HitS is operating globally. Our Dell team is based in Shanghai, and we also have a protein production unit in Suzhou. Frelux, where I am based, is located in Munich, Germany. The main focus is here on customized protein engineering and production, as well as fragment screening. Furthermore, it is home of our state-of-the-art biophysics platform, and so far all crystallography work in the HitS unit is done here at Frelux. Currently, we are also setting up a Dell laboratory as well. The same holds true for our Boston site, where also a Dell lab will be set up and currently Dell kits are processed. This talk will focus on fragment-based screening, but if you're interested in our Dell capabilities, I'm happy to invite you to the presentation of my colleague Alex Satz on Thursday. First of all, some general considerations about why we offer fragment-based screening. One reason is that it's quite complementary to classical HTS or Dell screening. In fragment screening, we are working with rather small molecules with a rather small size, around 200 to 300 Daltons. Due to their size, they can bind to small pockets as they are available, for example, on protein surfaces, a good starting point, for example, to block protein-protein interactions. However, first hits show normally a rather low affinity in the 2 to 3 digit micromolar range. One big advantage is though that fragments are quite simple chemical starting points. This allows for more flexibility during the hit to lead optimization stage, and the fragment hits can be grown, ideally supported by structural biology, linked or merged. This enables a very efficient way of sampling the chemical space, and this chemical simplicity for the fragment is also very helpful to efficiently optimize the pharmacokinetic profile together with potency of the hit. Before we dip into the experimental details, just a few words about the rationale behind the design of the fragment library. We set up a library that comprises approximately 3,100 fragments. The library was designed with strong support from our MedChem experts at WuXi. The library contains molecules from the eMolecules library, lab network, and there are also some proprietary fragments from WuXi AppTec. To select appropriate fragments, we applied various filters to remove frequent hitters and false positives, as well as molecules that are known to interfere with the assay formats or harbor unwanted reactive groups. All the fragments are synthetically accessible, show appropriate complexity, and are rule of 3 compliant. In summary, we selected a representative assembly of key pharmacophores, and in the end, the selected list was also manually curated by our MedChem experts at WuXi. On this slide, you can find in-depth information about the physicochemical properties on the Fragment library. If you're interested in more detailed information about our library, please feel free to get in touch with me. But let's take a step back and let's talk about the starting point of all screening campaigns, the protein production. At HitS, we offer customized protein production solutions. We tailor proteins towards the needs of the screens. We offer recombinant protein production from E. coli, yeast, insect cells, and mammalian cells. Depending on the respective needs, we produce full-length proteins, if possible, of course, specific domains, but we also keep in mind that structural information can be a very powerful tool to efficiently drive a drug discovery program. Since Krelux was historically a structure-based drug discovery company and is now a part of the HitS platform, we have a very high standard and QC criteria when it comes to protein quality. For every lot that we prepare, we run STS page and an analytical sec to check for purity and monodispersity. We do intact mass and mass spec fingerprinting to check protein identity and post-translational modifications. And last but not least, we check for protein activity, making use of our biophysical assay platform. Methods we are using range from simple thermal shift assays over MST and SPR to biochemical activity assays. In summary, we always produce proteins that are the best possible solutions for the downstream process, in this case, the screening approach. Just to give you an idea about our expertise we gained over the decades, just a couple of examples of targets we've been working on. In total, we produced over 1,500 proteins, out of which 1,200 have been assay grade. Furthermore, we established more than 250 crystal grade proteins for which we have verified crystallization protocols. Of course, traditionally, we worked a lot on kinases, but the requested targets become also more exotic and challenging. In the last years, we worked on several membrane proteins, such as GPCRs like GPR40, cannabinoid receptor, or beta-adrenergic receptor, ion channels, and secondary transporters. But also DNA and RNA binding and modifying proteins are really en vogue at the moment, such as helicases, nucleases, as well as immune modulatory proteins. Once sufficient quality and quantity of the most important assay reagent, namely the protein, is obtained, we are getting to the biophysics and screening stage. On our biophysical and biochemical assay platform, we offer more than 10 different assay formats. We are able to run a full characterization of your compound series. Currently, our main working horses for fragment screening and hit validation are microscale thermophoresis, in short MST, surface plasmon resonance, in short SPR, nano DSF, and classical DSF respectively. With these methods, we are able to offer fast turnaround times. We have the flexibility to change between different assay formats. As you all know, some proteins tend to behave well in SPR, but not in MST. For others, it's the other way around. Others only work in DSF. Combined with our protein production colleagues, we've optimized starting material, and we can check for the best possible assay format. And only once we identified the best protein assay combination, we will start the screening campaign. With this platform, we do not only identify hits, but we can characterize them in detail. We can check parameters such as KD, thermodynamics, and kinetics. Besides our working horses, we also use NMR, ITC, DLS, ASMS, or FP as routine assay formats. But which assay format is used for fragment screening? As you can see here, in this chart, various assays are used for fragment screening, such as biochemical assays, NMR, thermal shift assays, vertical screening, X-ray crystallography, or DSLS. The good thing is, these approaches are available either within the HitS unit or WuXi AppTec. But today, I want to focus on two different approaches, namely SPR and microscale thermophoresis. As you can see, the majority of the fragment screenings are done using biochemical assays, but we decided to focus on MST and SPR because the instruments we have in-house provide us with sufficient throughput and speed. And once an assay is established, we do not only identify hits, but also direct binding can be analyzed very accurately. And with regards to SPR, we can also take a look at the kinetics of binding, even though that might not be that relevant at the early stages of a fragment screening campaign. As I mentioned before, we think that the choice of the appropriate assay is also somehow guided by the target protein. Here you can see a comparison of SPR and MST. First, SPR. In SPR, the target protein is immobilized on the chip surface. This can either be done through covalent linking using NHS or melamide chemistry, or in a non-covalent way, for example, by capturing a protein via its HIS tag. However, throughout the years, we made very good experience with biotinylated protein that is immobilized on a streptavidin-encoded chip. Preferably, we biotinylate the protein using AppTec's. This can be done either in vitro or in vivo. Interaction of fragments to the target is measured on an optical biosensor. The throughput is pretty similar to MST and lies in the range of a couple of hundred molecules per day. Advantages are low protein consumption, high sensitivity, and accurate affinity and kinetics measurements. Disadvantages can be mobilization to the surface, leading to a decrease in stability or protein activation, as well as solvent effects on the signals. Secondly, and in contrast, microscale thermophoresis is a method to measure ligand binding free in solution. More precisely, the motion of the protein along a temperature gradient is measured. This motion is affected by charge, size, and solvation of the protein. Upon ligand binding, typically at least one of these parameters is changed and the KD can be plotted. Advantages are very low protein consumption, high sensitivity, and that binding is monitored free in solution. Drawbacks, of course, can be typically fluorophores are required, so also covalent or non-covalent labeling is needed, or as a second option, intrinsic tryptophan fluorescence can be used, which requires typically a rather strong intrinsic fluorescence of the target. At HitS, we have two fully automated screening devices for SPR and MST. On the one hand, a BioCore 8K, a high throughput 8-channel system. A couple of hundred of molecules can be screened here per day in a single dose mode. After identification of the hits, KD values can be determined in an affinity range between picomolar to millimolar. A similar throughput can be achieved by the automated instrument from Nanotemper MST. We have a fully automated screening unit in-house coupled to a liquid handler. KD values in the picomolar and millimolar range can be determined. Several hundred compounds per day can be tested in single dose mode, and approximately 80 KDs per day can be screened. This year, we decided to expand our MST capabilities and invested in a new Dianthus device from Nanotemper. The assay principle is very similar and is still based on microscale thermophoresis. However, the assay was transferred from glass capillaries to 384 well plates, but was a big leap forward. This dramatically increased the throughput. We tested the device intensively, and we see very nice correlation between capillary-based and plate-based instruments. Currently, we are looking at a throughput of at least 1,500 compounds per day in single dose and more than 150 KD values per day. But we are still optimizing the system. We expect much higher throughput in the future. In the last part of the talk, I will briefly walk you through our fragment screening workflow with a real-life example. We ran a fragment screen on human sting, and the whole project was conducted at HitS. First, we purified the protein and ran respective QC. Then we used nano-DSF to optimize the assay condition, which means screening for a suitable assay buffer, detergent concentrations, and DMSO sensitivity of the protein. Last but not least, we assessed protein activity qualitatively by determining ligand-induced increase in the protein stability. Based on this information, we established an MST and SPR assay. The Fragment screen was run on the automated MST device eventually and on the Dianthus in parallel. We started with a single fragment dose of 500 micromolar and then did a subsequent KD ranking. Hits were validated by SPR. As you can see, just the screening alone took 4 weeks. In the meantime, we set up a soakable crystallization system, which was verified by using the native ligand. Subsequent steps, SAR by catalog and support from the in silico team could be a possible next step. As I mentioned, in parallel to the MST approach, we conducted the screening on the Dianthus instrument together with nanotemper. And here we could drastically reduce the time needed for screening. In total, the screening took us 2 weeks instead of 4 weeks as before. So you can see we can significantly reduce the turnaround time and also the material cost. Therefore, we see very big potential in this new device. Here you can see a few snapshots of the assay setup in the screening results. We labeled human sting and could show low nanomolar binding affinities for the natural ligand 2,3 CGAMP. We ran the single dose screening at 500 micromolar. You can see the results here in the middle. The potential hits were taken to a subsequent KD ranking, and we observed a hit rate of 8% with fragments that bound in the 2 to 3 digit micromolar range. Interestingly, the identified binders, the classical MST and Dianthus screen, were very similar to the ones we identified in the Dianthus screen. This is in good agreement with results on other targets that we obtained, where we tested both systems in parallel in order to get an idea how well the MST and the Dianthus assay conditions can be transferred. The identified hits were subsequently validated using SPR and nano-DSF. Here you can see results with the tool compounds for SPR on the left and nano-DSF on the right. In SPR, we observed for the fragment hits we identified by MST also binding in the micromolar range. And once we tested these fragments in nano-DSF, we saw also significant shifts in the thermal stability. On the bottom, you can see just a summary of the screen. In total, we screened 2,600 fragments and identified 66 binders. In total, we used 3 orthogonal methods, namely MST, nano-DSF, and SPR. In the meantime, we also are working on setting up an NMR assay on this, and affinities were in the moderate micromolar range. Typically, a next step in these kind of projects is structural validation of the HitS by X-ray crystallography. This we can also offer at HitS. Since I'm running short of time, you can find here only a general overview on the crystallography workflow. In the ideal scenario, we establish a soaking system for the target protein. This enables us to set up soaking experiments at very high compound concentrations. These experiments we either run in-house or directly at the synchrotron, depending on the number of hits that we obtain, and that should be screened. The data are automatically processed and identified hits are manually refined. In case of success, this opens up all possibilities for structure-guided drug design and then would involve our medchem experts from WuXi. In summary, I showed you that WuXi AppTec's HitS platform provides a one-stop shop for your drug discovery programs in the target-to-hit phase. We produce high-quality, customized proteins for DEL and fragment screening campaigns. In our experience, this is one of the key factors for a successful project. I hope I could show that fragment-based screening is a suitable tool for challenging targets. Efficient sampling of the chemical space is possible, and often new, unique binding sites can be identified. At the HitS Biophysical platform, we offer tailored solutions for your target. I showed you an example of using MST as a tool to screen for target binders. Once hits are identified, these can be orthogonally characterized biophysically, biochemically, but also by structural biology. With this, I would like to conclude my presentation. I would like to thank you for your attention, and I'm happy to answer your questions.